Roger Williams University is hosting a crisis management seminar on May 3rd at their Providence campus. Crises, whether a natural disaster, cyber attack, or financial instability, can have severe repercussions if not handled properly. This is where crisis management plays a pivotal role. Join Roger Williams MBA students and expert speakers to learn how to prepare for the unexpected. The program is totally free and open to the public. You can register online at rwu.edu/events/crisis-management-symposium.
This is the Bartholomew Town Podcast.
With the increasing legalization of cannabis across the country, including most recently Rhode Island, the cannabis industry is growing at a rapidly accelerating pace. If you are already in the industry or wondering what is the best path to break into the cannabis field, well, the University of Rhode Island has a program to help educate you in the evolving space. Fully accredited by URI's College of Pharmacy, the online certificate program covers topics related to product development, chemical analysis and testing, and patient and customer therapeutics. The next application deadline for the spring 2023 session is November 29th, and courses start January 10th. Join them at 2 upcoming info sessions and learn more at uri.edu/online/cannabis or give them a call at 401-874-5280. Well, good morning, everyone, and some breaking news right now pertaining to today's episode. And the 5 Rhode Island dispensaries that have been approved for recreational cannabis were announced just about an hour ago, and they are Slater in Providence, Summit/Rise in Warwick, Greenleaf in Portsmouth, Aura in Central Falls, and Mother Earth in Pawtucket. So that sort of adds a little bit of specificity to some of the conversation that we have on today's podcast episode, which was recorded yesterday. So kind of backfilling that a little bit, some breaking news. Enjoy today's episode. All right, so we are here with Matt Santacroce talking recreational cannabis in Rhode Island, and we're just a couple of weeks away from a deadline or a date line, I should say, that a lot of people have been paying attention to, and that's December, when a lot of this stuff is going to come online. But there's still plenty of questions out there that are completely unanswered for some folks, and there's some gray area, and the entire implementation process is really interesting and something that I think we should get into. So that's exactly what we're going to do today. So Matt, thanks for hopping on.
No worries, Bill. Thank you for having me. Excited to be here and excited to get into it.
So I guess let's first just an overview of your role and how you fit into all of this.
Sure. So I am the Interim Deputy Director at the Department of Business Regulation here in Rhode Island. As folks might know, the DBR has had for several years now primary jurisdictional and regulatory authority over the medical marijuana and industrial hemp programs here in the state of Rhode Island. And pursuant to the recently enacted adult use legalization legislation that was passed by the legislature and signed by Governor McKee into law in May of this year, the DBR is also leading the transition and the implementation of the sort of first phase of adult use marijuana retail production and sales, which production has been happening since June of this year, June or July of this year, and sales will be beginning in December. So a big part of my job here at DBR is to oversee the Office of Cannabis Regulation, which is the 11-person and growing unit that is the sort of day-to-day regulatory lead for the executive branch in the state of Rhode Island. Like I said, in the cannabis space, we've got a great team here, and we've been working really hard with our partners in the industry to get ready for December 1st, and we're very excited about where things are at right now.
So where do we begin with this? Because I guess the obvious thing to do would be to talk about, we can almost work backwards from what happens on December 1st, and then we can talk about how we got there and the process and so on. But just a baseline of December 1st comes, what can people expect, whether you're someone who is an interested cannabis consumer or you're somebody who is just totally on the outside of this industry?
Yeah, totally. So we've got, I think, a very unique and a very practical and logical framework for implementation that's been set up in the legislation and that we're excited to be executing on. I want to just give a quick shout out and kudos to the legislature here in Rhode Island, and particularly the folks that were driving this vehicle, this piece of legislation through this session, have been focused on this issue for a very long time. In particular, Representative Slater, Scott Slater, Chairman Josh Miller, Majority Leader Mike McCaffrey, and in the Senate, and some very talented and dedicated staff professionals in both the House and the Senate who brought this legislation into a very, very good place by the end of the session. We're excited to be working with them on it, and excited about where it landed. And what the legislation contemplates is really sort of a two-stage implementation, and one that is going to get Rhode Island adult use sales started more quickly than any other state in the country has done it. We're going to be going from bill signing to sales in 5.5 or 6 months, which is orders of magnitude more quickly than any other state has done it. As a point of reference, Massachusetts took almost 20 months from the point that their ballot referendum passed to the first shops opening. New York and Connecticut passed bills in 2021 and are still, probably months, if not longer, away from sales started. And we're going to be getting the doors open for adult use customers in Rhode Island in under 2 weeks. So we're excited about where things are at. So stage one of this, which is where we are right now, basically says we have a thriving industry here in Rhode Island right now. Let's give that thriving industry a running start on adult use production and adult use sales. And we're going to do it quickly. We know that there's businesses that are growing, producing, and selling marijuana compliantly in the marketplace right now, and they have been for years. They know how to do this. We're going to leverage that existing capacity in the market, that existing regulatory capacity at DBR, and we're going to work to make sure that is brought to the forefront and leveraged in an expedient and logical fashion. So on December 1st, we're going to have sales started at very likely 5 existing licensed medical marijuana compassion centers in Rhode Island. So if you're a medical marijuana compassion center right now, under the legislation, you're authorized to apply to the Department of Business Regulation, my office, for what we're calling and what the bill calls hybrid retail status, which says you've been selling medical marijuana in Rhode Island, assuming you've done that compliantly, and you can meet a series of criteria that we've laid out in the application to prove that you're going to be able to basically do both medical and adult use sales and not have adult use sales happening at the expense of medical sales. You're going to have the privilege starting on December 1st of serving both customer populations under the same roof. And so we've got, as we mentioned a couple minutes ago, 5 complete applications in the door for hybrid adult use retail status. We're feeling very, very good about where those applications are at, and expect that those will be very likely approved in the coming days, such that those 5 retail shops will be ready to get open for business on December 1st and serve both a medical marijuana patient population and a 21 and over adult use recreational population at the same time. The supply side, so that's the retail side of it. The supply side of it is equally interesting in my mind. As you probably know, we have, or may not know, 65 licensed growers here in the state of Rhode Island, which is a large number for a state our size and a market our size. But they're growing and producing, some outstanding product relative to the region and relative to the rest of the country. But for a long time have been, candidly struggling a little bit under a set of circumstances with a declining patient population. Up until this year, only 3 retail outlets in the state to sell to at wholesale. And so, they anticipate correctly a significant market expansion and significant market opportunity with this broadening of adult use retail sales. So that's what's happening now. That's what will be happening on December 1st, which is adult use, non-medical marijuana patients can go into a medical marijuana dispensary, a compassion center. There's going to be a separate line, separate kiosks, in some cases, special products that are reserved for the medical marijuana patient population. But by and large, we're talking about the existing retail outlets that are going to be serving a new customer population compliantly, heavily regulated as always, on December 1st. So it's very exciting.
Yeah, so that reset you basically just did right there. The 5 of the 6 medical dispensaries will be offering recreational starting December 1st. And there's always a concern where, the medical side, I mean, let's be honest about it. There are people in there that it is, you don't want to call someone's health or a physician's diagnosis into question, but let's be honest about it. There are people in there that are not severely afflicted by something that they're using cannabis for medicine for, there are definitely people in there who just say, hey, look, let me get a card and go in there and basically use it as auxiliary recreational. Nonetheless, there are people inside every medical dispensary day in, day out that are severely sick, oftentimes, whether it's cancer, any number of medical issues. And I've heard concern from some people that say, hey, look, I have to go in there. This isn't fun. This is like going to the pharmacy to pick up a prescription. So you're saying that their experience will not be impacted negatively. They'll still have access to their medicine, and they're not going to encounter, a scenario where there's an enormous line or product shortage as a result of the inclusion of recreational in these 5 of these dispensaries. For the most part, it's been worked out ahead of time.
Yeah, absolutely. And in our minds here at the Office of Cannabis Regulation, there's a very important sort of set of trade-offs that are contemplated in giving the medical marijuana dispensaries first crack at retail sales in Rhode Island, which is to say you need to make a very strong effort to maintain your current service levels for the medical marijuana patient and not have what their experience deteriorate at the expense of, adult use retail sales. Indeed, the hybrid retail approval is conditional on ongoing compliance with the medical marijuana regs, ongoing renewal of your medical marijuana license. It is in no way the case that, we issue the hybrid retail approval and people can just walk away from their medical marijuana business. It's the opposite of that. So in the application, we've even gone so far as to say, like, in detail, tell us what you're going to do to make sure that you have that you're avoiding a scenario where a true medical marijuana patient is stuck in your parking lot in a sleet storm at 11 a.m. on December 1st and is not able to get their medicine. So, like, tell us, we've asked them to literally physically walk us through the customer travel for a medical marijuana patient in the hybrid status. And we did that all last week out in the field. Yep. Different lines, different retail kiosks. We've asked them to show us in their applications, and then, out there in the field last week, some medical marijuana patients often need like a private consultation space. They might have questions about their particular condition, questions about the product offerings, effects, desired effects, that sort of thing. And we've asked these businesses to create or maintain a private, suitable medical marijuana patient consultation space. So this is kind of like the customer-facing side of it. The non-customer-facing side of it is, what do you have in the back of the house? What do you have in stock? Yeah. How are you going to be making sure that you're both managing medical marijuana inventory and adult use marijuana inventory at the same time? What sorts of products are you going to be setting aside that are specifically dedicated to the medical marijuana patient community? Higher potency tinctures, capsules, that sort of thing. Right. And I got to give a lot of credit to the businesses. They've been really working hard at this because they get it. And, these are businesses that have been in the medical marijuana space for, in some cases, 10 years or more. And so they really, truly care about it and want to get it right. And so it's been nice to see the extent to which our incentives are aligned on this, and everybody's making sure that we can roll out this sort of hybrid retail situation on December 1st and not have it come at the expense of the medical marijuana patient community. But it's been an interesting exercise for sure.
Yeah, really. I mean, it's a unique business model in that regard. I mean, you don't really, you can make a comparison to say, hey, look, you go into a CVS and there's, a different set of circumstances if you're buying some Tylenol versus if you're picking up a prescription. But even that really doesn't overlap too much with the hybrid theory that is going into dispensaries at this point.
Right. And really what we're trying to make sure is maintained at the end of the day, Bill, is like access. Yeah. And that's both like physical access. Can you get to a point of sale, and also like quickly and discreetly and safely? And then also, like, do you have access to the products that you've been depending on for in some cases many years to manage pain or other sort of chronic symptoms?
All right, let's talk about phase 2. So we get to December 1st, 5 of the medical dispensaries are going to flip to hybrid, most likely. Yep. And what is the implication of the ballot question, the municipal ballot question that many of the, I think, what would it be, 28 of the municipalities in the state, or pardon me, no, it would be, doing the math there, 39 minus 6, 33 of the municipalities in the state voted on. I think all but two or three municipalities voted that they would have recreational. All but six. Okay.
Yeah.
So I'm glad someone has their facts straight here. By the way. Most municipalities are going to come online at some point. What does that phase 2 look like, and when can people expect to start to see new businesses, new infrastructure pop up?
Great question. So, and just to flag it, we do expect very likely an additional 2 medical marijuana dispensaries to come online in the month of December and January, and probably at that point convert into hybrid status as well. So just to flag it, we anticipate that by the end of January, we have 7 total retail outlets for adult use. But that, again, is all falling under the umbrella of the sort of medical marijuana compassion center transition into hybrid status framework. Phase 2, as folks may know, is going to kind of go as follows. The bill that was signed into law contemplates 33 total retail licenses in the state of Rhode Island. So there are 9 allowed medical marijuana compassion center licenses right now. As I said, we'll have 7 of them online by the month of January. The additional 24 will be allocated according to a framework, a set of rules and regulations, and ultimately an application process that'll be determined by a new governance body in the state that's called the Cannabis Control Commission. The legislature, the legislation that was signed into law sets up a regulatory entity that closely resembles, in some respects, regulatory entities that exist in other states, where there's a sort of gubernatorially appointed and Senate advice and consent Cannabis Control Commission made up of 3 people, again, appointed by the governor, confirmed by the Senate, that will get to work developing full-blown adult use rules and regulations, very likely at the beginning of next year. That set of rules and regulations will deal with soup to nuts, all of the adult use regulatory considerations and policy considerations, from packaging and labeling to product types and potency limits. And very importantly, to your question, Bill, the method and timing of the additional 24 retail licenses. Those are going to be new standalone retail licenses that will not be integrated with existing medical licensees or existing cultivation. And importantly, will be set aside in some number for social equity applicants and also for worker-owned cooperatives, which is a very interesting sort of concept and setup. We have 6 zones for regulatory purposes right now under the medical marijuana program in the state of Rhode Island that break the state up into sort of jurisdictional subdivisions. The legislation allows for 4 new retail licenses in each of those 6 regulatory zones. 2 of them are just open. 1 will be set aside in each zone for social equity candidates. 1 will be set aside for worker-owned cooperatives. Again, the specifics of that are going to be determined by the Cannabis Control Commission. In most other states, full adult use rules and regulations have taken, on average, 6 to 12 months to promulgate. So I'd expect to see applications become available for those new retail licenses at some point, probably the end of 2023. Everyone's hoping it's sooner than that. But the Cannabis Control Commission sort of coming into existence first is going to be the real gating factor there, and then get into work on developing that framework.
And that was kind of I guess a political football between getting this legislation passed and not getting it passed at one point, was who would control the Cannabis Control Commission, how many appointments, and so on and so forth. So basically that's been resolved, and now it's just a matter of stocking it, for lack of a better term, and getting it up and running. Is that at the next level, or what's the next step for the Cannabis Control Commission, I should ask?
So, DBR's been, laser focused on getting sales started in December. The Cannabis Control Commission appointment process is, I know, something that the governor's office is thinking a lot about right now, and is working with the legislature accordingly. Beyond that, I don't have a lot more to say about where that process stands.
Gotcha. All right. Kind of going back to how we got here. Folks may remember the lottery, the the guy in the goggles reaching into the boggle balls and so on and so forth. So take us through the process from your perspective, from DBR's perspective, of how we got to the point where we are now in terms of the participants on the retail side of both the new medical dispensaries that'll come online likely and the recreational applicants. How do we get to this point?
Yeah, so it really kind of goes back to 2019 when the legislature passed a budget article expanding the number of licensed compassion centers for the first time in close to a decade. Folks may know that we've had kind of the big three licensed compassion centers in existence in Rhode Island for many years at this point. Slater Center in Providence, Summit, now known as Rise in Warwick, and Greenleaf in Portsmouth. And for a long time, those were the only three places to buy medical marijuana in the state at retail. And the legislation passed in 2019 expanded that from 3 to 9, so adding six new compassion centers in the state of Rhode Island. The DBR then got, and this is before my time, but the DBR then got to work in 2019 developing the rules and regulations for how those 6 new licenses would be awarded. Those rules and regulations developed this lottery process that we then executed in late 2021. So we began soliciting applications in 2020. And by the way, there's this pandemic thing that happened in the middle of all that, and things got a little wacky. But we received close to 50 applications for these 6 new licenses in 2020. In late 2020, early 2021, which is when I started at DBR, we began evaluating those applications for compliance, completeness, adequacy, that sort of thing, but with a relatively low bar for entry into this lottery. We basically said, if you are minimally qualified, which is, do you have a complete application? Are you credibly going to be able to operate a medical marijuana business in the state of Rhode Island? Have you met all the requirements under the rules and the regulations? If yes, you go into the lottery. We ended up qualifying just over 40 of those applications for the lottery. Only a handful were rejected for incompleteness or non-compliance. And then there were, and that was sort of early 2021, there were unfortunately a handful of delays related to some administrative litigation on behalf of some applicants that were not qualified for the lottery. That was, again, totally in the normal course of business, 100% rights that were available to them under the Administrative Procedures Act, but did require us to kind of delay that lottery a little bit so that we didn't accidentally, go forward with a process that was incomplete or inadequate. Those were resolved in the fall of 2021. And then, as you noted, we moved forward with the public lottery event in October of 2021, October 29th of 2021. Actually, it's 2 days before Halloween. So in that process, as you saw, and as folks may know, we selected 7 of the 42 or so applicants at random across the 6 of the 42 applicants at random across the 6 zones. Those 6 applicants in zones 1 through 6 received letters of conditional approval from the department to move forward with building their dispensary, meeting all of the final requirements for licensure. And at this point, we have licensed 4 of those 6 new applicants to date in zones, everyone except for zone 1 and zone 3. So that's where we are right now. Right now, today, we have twice as many places to buy medical marijuana in the state as we did a year ago, which I'm very excited about. It's a big deal for patients. It's a big deal for the industry. And it was really important to me and to our office that we continue to push on expansion of the medical program, because as we were talking about a couple of minutes ago, We knew all along that it was going to be the on-ramp to adult use. And so a thriving medical program meant a healthy adult use implementation. And I'm excited that that's, pretty much where we are today.
What else? Is there anything else that people should know here at this point as we kind of start to get ready to shift into the next phase and probably even phase 2 as people are still listening to this?
Yeah, I think a couple of things. One is, and folks may have seen the new billboard that's up on 95 right now in Pawtucket, but we've got a real opportunity here to bring folks into the regulated market on the customer side that may not have been there yet or before and may not have been there in Rhode Island. We have, I think, a really strong industry here. We've got a number of very strong growers and some very competent and innovative retailers. And as I like to say, and the industry certainly likes to say, legal cannabis in Rhode Island is safe. You know what you're getting has been tested for everything from pesticides to heavy metals to potency. You know that the retailer is obviously legitimate, licensed, regulated, and that you can feel good and confident about making your purchase in a dispensary in Rhode Island, either as a medical consumer and adult use consumer, just like you would feel confident going to buy a pair of shoes or a bottle of wine or whatever. And that's what we strive for, and that's what we've been working very, very hard to bring into existence here in the state in anticipation of adult use, making sure that the product that's on the shelves is safe, is tested, is high quality, and I think that's where we are. And again, I can't really give enough credit to the industry for being right there along with us at the Office of Cannabis Regulation as we've moved forward kind of towards this next step in terms of the expansion of the industry in Rhode Island. And then, what I'll also say is that I don't think folks should expect it necessarily off the bat to look like it does in Massachusetts right now. Mm-hmm. To the extent that people are going or are interested or familiar with a retail experience at a Massachusetts adult use dispensary, that's something that's going to be a year or two down the road in Rhode Island. What you're going to be getting in Rhode Island is a compliant, high quality, and efficient retail experience that may not have at the outset the sort of bells and whistles that you get in Massachusetts in terms of packaging, labeling, that sort of thing. You're still going to see the relatively modest packaging and labeling that medical marijuana consumers have been familiar with in Rhode Island, but the product inside is going to be, weed sells itself, right? And at the end of the day, what the consumer cares about is having high quality, affordable product that's accessible and safe. And so that's what we're going to have available for sale in Rhode Island starting in December. The sort of like phase 2, maybe some more aggressive packaging and labeling limits, a more aggressive advertising, that sort of thing is going to happen, down the road once the Cannabis Control Commission gets their hands around packaging and labeling regulations, advertising regulations, that sort of thing. The way we're going to get the doors open for adult use on December 1st is to say, listen, let's work off the existing medical regs. At the end of the day, what's inside the jar matters a whole lot more than what the jar looks like. The patients know that. The customers are soon going to figure that out. And we're going to be, getting product to market at a significant discount relative to what's in Massachusetts, by the way. I think you'll see in December as well. So, it's exciting stuff. That's
interesting right there, that last piece, because that competitiveness with our neighbors is something that was long been argued in the sense of those in favor of bringing adult use recreational online here. The argument has been, well, Massachusetts is right across the border and they're making all this money that we're missing out on and people are going over there anyway. So you're saying that there's an opportunity here for a more competitive environment in Rhode Island where consumers will face prices that are lower than Massachusetts potentially?
Yeah, that's exactly what I'm saying. And, wow. I think the bottom is I don't want to say the bottom is falling out of the Massachusetts retail market, but you're really starting to see some softening of the Massachusetts retail market in the past probably 6 months, but certainly in the past 3 months. The price points that have been common up there for a while now, that they have, hundreds of stores online, just aren't really sustainable. And I think that the retailers in Massachusetts are starting to kind of have to readjust to that. I think Rhode Island coming online is going to only heighten that sense of urgency. And from my perspective, for good reason. And there's also the opportunity cost to factor in here, right? Instead of having to drive to, Rehoboth, Seekonk, Attleboro, Uxbridge, what have you, folks are going to be in almost every case 20 minutes away from a retailer, if not much closer. And that's going to, I think, just that convenience factor is huge in terms of keeping people within our borders, purchasing Rhode Island grown product at Rhode Island retailers. And obviously the tax considerations there are substantial.
Great stuff, Matt. And what a great overview as well for everybody to kind of get a sense of exactly where we are right now. I think it's everything you need to know about recreational cannabis in Rhode Island. That'll probably be the title of this episode. And really appreciate it.
Well, Bill, thank you for having me on, and happy to come back anytime.
Awesome.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.